Welcome to another knee moment from Knee Fit in 5 and MSM Products. I'm Dr. Matt Lawless.
And I'm Scott Johnson with Physical Therapy. Dr. Lawless, we got another email from a lady. Her name is Peggy. She has knee arthritis, and she's been on the Knee Fit in 5 program, and she's doing very well with that, but she's still having some discomfort in her knee, and she was asking me about injections. And I thought, boy, that'd be wonderful for us to get you on the video so that you could share that with her and just tell her what her options are and when maybe it would be time to consider doing something like that.
Very popular question. Injections with knee arthritis. I assume Peggy has knee arthritis, and that's why she's asking about injections. They are essentially 4 different kinds of injections you can put into the knee. By far the most common are steroids, sometimes called cortisone, prednisone, whatever. And when we talk about injections, what we're doing is we're actually putting a needle into a patient's knee and injecting the medicine directly into the knee. So cortisone is very popularly used. It does help the symptoms. Most injections, the cortisone injections work well in mild to moderate arthritis. As the arthritis gets more advanced, then the injections don't seem to work quite as well. But in mild to moderate arthritis, they seem to work very well. So the cortisone, people ask me frequently, how long does it last? And it's very difficult. It's very unpredictable as to how long a cortisone shot will last. In a mild arthritis, I've seen it last months, even years, before I'll see a patient again. In a more advanced disease, then it's much shorter, maybe only weeks or something. The insurance companies currently are paying for cortisone injections about every 3 months. So every 3 months is a pretty reasonable time to come in to get a cortisone shot. Now, too many cortisone shots can be bad for your cartilage because you can start breaking down the cartilage in your knee, at least in theory, with repeated cortisone injections. So doing them more frequently may lead to quicker advancement of your knee arthritis. So that would be the only real downside to multiple cortisone injections. The second kind of injection is something called hyaluronic acid. Hyaluronic acid is essentially like synovial fluid. So in your knee is surrounded by synovium, and the synovium makes synovial fluid, and that's what causes knee effusions in people with like arthritis. So the hyaluronic acid injections are essentially a concentrated form of synovial fluid. And what they're done is an injection into your knee, just like the cortisone. The needle goes in your knee and it's injected. Those seem to work well again in mild to moderate arthritis, and they seem to last on the average about 6 months. So insurance companies, to get a hyaluronic acid injection, usually have to have failed a cortisone injection or got short relief from a cortisone injection. And then they'll approve the hyaluronic acid injection, but they'll only approve it every 6 months. So if it works every 6 months, then that is a very reasonable alternative. It probably doesn't have any adverse effects on your cartilage, and it does seem to work well. Now, people ask me, does it actually put cartilage back on your bone? No, so far we don't have anything that reverses arthritis. Arthritis is a progressive loss of cartilage, and any of the injections we do, even the 2 I'm getting ready to talk about, don't put cartilage back on your knee. The injections are simply to help relieve the pain. And in my mind, the relieving the pain is important because it then, Peggy had talked about being on Knee Fit in 5. It makes it more comfortable to do the exercises, and the exercises is probably what really leads to the long-term relief of symptoms. So we have the gel injections, the hyaluronic acid. They're also called gel injections, and there's multiple different manufacturers of the gel injections. Maybe some advantage to the gel injections with a higher molecular weight. That's kind of debated, but all of them seem to work. The third kind of injection is something called PRP, or platelet-rich plasma. What that is where they actually draw a patient's blood. So the patient will come in, have their blood drawn, put it in a centrifuge, which is just something that spins the blood around very quickly. And when blood is spun around quickly like that, it separates into different layers. And so they take the platelet-rich layer and inject that into the knee. So it's usually only a few cc's and then injected right into the knee. Now, the tricky thing with this one is insurance does not pay for it. So this is usually an out-of-pocket expense. Insurance usually covers the cortisone shots and the hyaluronic acid or gel shots, but it does not cover the PRP. So it's an out-of-pocket expense, anywhere $500 even on up from that. So a PRP shot is usually a one-time shot. Sometimes people will do a second shot. And just like the cortisone and the gel, it works well in mild to moderate arthritis. Most of the studies show, and again, we have references for these articles on our Science Behind Our Why on the Knee Fit in 5. They show that the gel seems to work a little better than cortisone, and PRP and gel seem to work about the same at 6 months. But when you get out past 6 months, the PRP actually seems to provide a little better pain relief. So the PRP probably offers a longer term solution to the knee soreness than the other two kinds of injections. The downside being that it's an out-of-pocket expense. So the fourth kind of injection is a stem cell, and that's something that's become very popular lately. Stem cell injections, do stem cells work? So far there is very little literature on stem cells and whether they work or not. What we probably can say is it's probably not going to reverse your arthritis. It's not going to put cartilage back on your bone. The patients I've seen that have had them obviously are coming to see me, so they haven't worked. So it is an out-of-pocket expense, and the PRP, I said, usually $500 or a little more. So a stem cell shot is usually in the thousands, anywhere $2 to $10 to even more $1,000, and insurance does not cover it. It is an out-of-pocket expense, and so far there's no science to support using it. So I currently kind of discourage my patients from getting the stem cells because it is so expensive and we don't have any proof that it works. A lot of people that are using the stem cells give anecdotal evidence that, I gave it to my sister and it worked, but that's all we have is anecdotal talk. We don't have any real science supporting that. So the way I kind of direct patients in my practice to kind of summarize this discussion is I usually start people with one cortisone shot. Okay. The adverse effects of one cortisone shot are probably exceptionally limited and probably doesn't do anything bad at all. Depending on the length of time I get from that, we'll direct what we do again. So if the cortisone shot lasts several years, well then shoot, I'd repeat it again. If it only lasts a month or so, then at that point I'd probably try a hyaluronic acid injection. And during this, if the patient wants to try a PRP injection, I think that's very reasonable too. I don't see a real downside to doing the hyaluronic acid injections or the PRP injections.
Okay. So Peggy, I hope that's helpful for you to answer your questions about the injections. I'm going to anticipate that you might have a question beyond that, and that is when to start doing exercises again if you decide to get an injection. Should there be a delay in doing that? And so I'll throw that question back to you.
Great question. Depends on who you talk to, and I don't think, again, there's any real science to direct us through this. I usually tell people to let their knee be their guide. So a cortisone shot's going to make them feel very good. So I tell them after they leave the office, don't do anything you wouldn't do normally. Okay. So if normally you're doing some squats, some lunges, keep doing squats and lunges. But don't start doing extra or weighted if it's something you're not used to doing. So essentially continue progressing with your exercise regime. Just don't really jump up too quickly. Kind of listen to your knee.
So there you go, Peggy. If you decide to get the injection, just stick with the routine that you're following with the NeFit in 5, and it sounds like things will work out pretty well for you. So we wish you the best.